So welcome to the virtual information session about COVID-19. We are meeting today from 6 to 7:30. And just a little note that we will have some time at the end of the session for some question and answer period. And we'll go ahead to the next slide. So from your screen, you should be able to see the agenda. We have our opening and the meeting called to order by myself. Number 2 will be opening prayer by Darlene Schwanquit. Oops, sorry. 3, meet with the emergency response team. Number 4, timeline highlighting the emergency response team's work to date. Number 5, review COVID-19 Q&As. Then moving to the next steps and any additional questions from the participants, and then closing remarks. So I do welcome everybody to the session, and really happy that you can be here, and happy to see that the emergency response team is here to assist with the presentation and answer any questions that you may have. So we will proceed and go with the opening prayer by Darlene. Miigwech, Darlene.
Habosho, Gunukwe Gokto Dem. I'd like to say miigwech for this day. I'd like to say miigwech for the community that has come together to hear today about where our community is at in regards to our response to the pandemic and what our next steps are going to be. I'd like to say miigwech that the team that has been working together, that we have been working with a good heart and open mind, and that I give that gratitude that part of the year was also a transition, and that it was a very smooth transition from one Gimon council to the next, and that we didn't lose momentum. The unity stayed strong. I'd like to say miigwech for that. I'd like to say miigwech to our community who do have their struggles in trying to maintain and follow the SOPs and maintaining what our team encourages in regards to that social distancing, following the orders that are set out, and as we follow very similarly to the province's orders. And I ask that that as our community seeks that clarification as to what the clarification, I guess, as to where our community is going next, that they be patient, because things take time, and we want to ensure that we think about the best safety of our community, and also moving towards the new normal. And I'd like to again say miigwech to all of you for being here this evening. With that, miigwech.
Miigwech. Very nice. Okay, so we'll move on to the next agenda item, which is meeting the emergency response team. So as you can see from your screen, we have listed all the individuals, and majority of you already know everybody who's on the response team. So there's myself, Gima, Pamela Linklater, CEO, Arvind Sharma, the Director of Lands and Economic Development, Cheryl Conway, Chief Financial Officer, Darlene Schwanquit, Director of Education and Social Services, Gary Napont, Director of Housing and Public Works, John Bilali, Director of Governance and Special Projects, Marina McCumber, our Community Health Nurse, Michelle Parent, our Human Resources Manager, Isaac Valancourt, our Communications Officer, Emily Watt, who's the Executive Assistant to the CEO, and Loretta Miller, who is the Executive Assistant to the Political Office. So I hope I got all of the titles straight. Did anybody just want to do a quick hello and from the team? Okay.
Yeah, I just want to say quick hello and thank you to those attendees joining us tonight, and I look forward to answering any of your questions later. Miigwech.
Okay. Miigwech, Gima. And I imagine Gima speaks on behalf of the whole team. So we'll move on to the next agenda item, which is the timeline highlighting the emergency response team's work to date. So on my screen, it's kind of small, so I'm going to go and look on my bigger screen, and I hope that you can see all of the words because it's a little bit big on my end. So back in March of 2020, we've had the pandemic was declared on March 11th by the World Health Organization. The state of emergency declared by the Ontario Premier Doug Ford was declared on March 17th and extended to July 24th. So you'll notice that the extension dates do reflect the time periods, and then when we come to July, it's updating it with another extension. The state of emergency declared in Adikmakshing and Anishinaabeg by Gimong Council was declared on March 30th and then extended to August 29th of 2020. The Adikmakshing office was closed and staff began working in virtual mode during that month. And that was at the end of the month as well. Maintained essential services, so that included our personal support workers, nurse practitioner, physician visits, other tasks for members that were able to work remotely. That's not the whole list of essential services that was provided, because we continued with garbage pickup and our family support workers, child welfare, assistance to our families. In April of 2020, we had the COVID-19 pandemic lockdown, and that's when that began. So the emergency response team sought emergency funding and received an Indigenous community support fund of $180,000. This funding was used to purchase PPE, upgrades, and install touchless equipment in the offices and band buildings, and purchase equipment for the isolation center. There was a few more things noted, but we didn't put everything down there. In May of 2020, the emergency response team purchased and distributed tablets and additional internet services for elders who required this support and technology. We also implemented the Medium Support Program in May of 2020 as well, which is really going well for today too. In June of 2020, we did have personal protection equipment kits that were put together and distributed to the community. And we also had our PP isolation kits as well for our members through the health team. And that was to prepare for an outbreak, if there was an outbreak, and which there wasn't. The health department, in collaboration with the ERT, drafted and submitted a reopening plan to Gimong Council. The plan was approved and continues to be updated and posted to the website. Our last update was March of this year. Due to the volume of traffic in the community, a border was put up and remained in effect until June 19th of 2020. In July, on July 20th, a briefing note was submitted to Gimong Council to approve the reopening of the community center. The community center reopened July 27th and was used for a COVID testing center at that time. And that was the first testing that we held in the community, and that was on July 16th. And that was actually the only testing that we did hold in the community. And at that time, there was 0 cases. The state of emergency was extended by 1 month to August 29th as Ontario entered stage 3 of the reopening on July 17th. Gimong Council, the order was amended to reflect the extension of this state of emergency. Also, the reopening of the community plan was developed and approved July 22nd by Gimon Council. So moving on, in August of 2020, the reopening plan was updated and presented to Gimon Council on August 17th. The updated plan was approved and uploaded to the website. The updates included further precautionary measures and restrictions on events and gatherings. The state of emergency was extended to August 29th, and Gimon Council order was updated to reflect that extension. The administration received $98,000 from ISK on August 7th, and a public health stream approved $10,250, that should say, for PPE supplies, and ISK infrastructure approved $61,009.86 on August 18th of 2020. Some of those funds, again, were used to support all of the measures that we needed to take place and enact in the community. In September of 2020, the emergency response team began the process of updating the pandemic to reflect new measures and response processes. The state of emergency was also extended to October 31st, and Gimon Council order was updated to reflect that extension. So you'll notice there's a lot of extensions, right? And based on the government, when they extended their emergencies, we always recommended that we would go about 2 weeks past whatever the government was doing, just to see what the impacts of COVID-19 was doing in Sudbury and in the province. And then this way we can adjust our plans. In October of 2020, the reopening plan was amended and approved on October 5th and distributed to staff and community. And at that time, that's when we started to involve our agencies and organizations that came into the community as well to provide services. And I believe in November is when we started meeting with Nagda Windeman and began sharing our plans with each other just to ensure safety of our families. The state of emergency was extended to January 31st of 2021, and Gimon Council order was updated to reflect that extension. Just to make a note, the order is like a bylaw. So the bylaw is always supported through a band council resolution. So those were the documents that always get signed and approved by Gimon Council to extend it. An application was completed and submitted to continue accessing the Ontario Emergency Support Fund to continue supporting COVID-19 related positions in the administration. So this included a COVID screener for the community center and staff and at directed functions. So at that time, we seen the need to ensure that the active screening was being held at the offices to ensure safety of staff and all the members utilizing essential services. In November of 2020, the updated pandemic plan was reviewed by the emergency response team and presented to Gimon Council on November 30th. The plan was approved and shared with the community along with other organizations and agencies coming into the community. The reopening plan was amended to include Appendix F, protocol for event planning with the organization, and submitted to Gimon Council November 2nd. The plan was approved and updated on the website November 5th. So the event planning was really an important piece in order to ensure safety of all of our staff and all of our community members accessing any type of event. And that's when, during the summer months, there was, a decrease in the measures that were held. So we wanted to ensure that safety was always number one when it came to our community. In December of 2020, the Mama-West-Wiying and First Nation Digital Health Organization submitted a proposal to implement remote monitoring program, and that was approved. This allowed our health services to conduct wellness checks remotely. And a program coordinator and an RPM were hired to operate this program. Unfortunately, it didn't start right away. I believe we started that at the end of January. And it was a program where we had the 2 individuals, and if there was any positive cases in the community, they would call them and provide them with an isolation kit and different supports, any medical advice and things like that. In December of the Medium Support Program was temporarily located in the steel building at the community garden until a permanent location was found. So bringing us into this year, January 2021, variants of concern became known by the World Health Organization. And the variants of concern, you still hear about those today and are really of concern for today's as we move into the pandemic. A proposal to make the necessary renovations to the community center was approved. The renovations included a new ventilation system for the proper air exchange and further COVID-19 preventative measures. A vaccine survey was sent out to the community to determine interest in receiving more information about the vaccinations. And at that time, I believe we had, about maybe 64 responses at that time. In February of 2021, the state of emergency was extended to March 31st, and Gimon Council order was updated to reflect that extension. The emergency response team or the Medium Support Program reopened February 1st and was located at the library and continues to operate today at the library, and very successful. The emergency response team extended coverage of Wi-Fi connections for 14 homes in the community and 2 remote homes until March 31st of 2021. And the emergency response team began planning for the vaccine rollouts in the community and establishing a vaccine clinic. We began receiving statistics from ICIS on testing. Now, ICIS, if I could remember what it stands for, oh gosh, it's not going to come to me, but it is an organization that is sanctioned by the Chiefs of Ontario office, along with that partnership with Laurentian University. So they have epidemiologists who review all of the statistics that come in, and how it's completed is they take a look at our health card number, our status number, and our address. And those 3 sources of data are put together, and then they come up with our statistics for our on reserve and off reserve. So those statistics are shared with the Gimon Council and with the community. We began, on February 22nd, Gimon Council declared a mental health and addiction state of emergency. In March of 2021, March 7th, the first vaccine clinic was held in the community at the community center, with subsequent clinics on the 21st and 28th. I didn't put the numbers down, and I didn't ask Isaac to put the numbers down, but you should be able to find those in the updates that go out to the community on a weekly basis. The state of emergency was extended to April 31st, and Gimon Council order was updated to reflect the extension, and additional revisions were made to the reopening plan to reflect additions to the reopening criteria and plan for the border closure. The revisions were approved and updated on the website. In April, the state of emergency was extended to May 31st, and the Gimon Council order was updated to reflect that extension as well. Another vaccine clinic was held on April 18th, making the total vaccinations in the community at that time was 248. In May, the state of emergency was extended to June 30th, and Gimon Council order was updated to reflect that extension. Another clinic occurred on May 16th, And that brings us to today, where we have been advised by our public health Sudbury and districts that we can begin some youth vaccine clinics from ages 12 to 17 years of age. So with that, we did have to submit numbers, preliminary numbers, and we've looked at those numbers, and what I've calculated was about 101 youth that are in that age category, but they both live in the community and outside of the community. And so what we did is advise public health that we would require about 90. So if you know of any youth who are interested, or parents of the youth that are interested, please contact our vaccine planning team, who consists of Marina McCumber, Nithya Joseph, my assistant, and Darlene Govro, health services clerk. And they will book those appointments in. We are scheduled for, I believe, mid-June to host that clinic. And I've requested that it be held on a Sunday, just to be mindful of the school and children going into online schooling. So that was a lot of reading. And I tried to input more information that I can, but to be mindful of the time as well. And next on the agenda is a review of the COVID-19 Q&As. So what we did receive was some questions with regards to different items within our emergency response, and tried to respond to them in a fashion that's going to give you enough information and provide those answers. So in the review, what we had, the first question is, what is the definition of a border closure? And we had the assistance of Arvin's team with the border closure, and those responses are border closures at Adikmekshing largely consisted of checkpoints at the bridge at entry to the Reserve Road and on Ojibwe Road in view of looming COVID-19 pandemic in the month of April of 2020. To start off, it was a total closure to external visitors. However, restrictions were eased down to allow for visiting, and the border functioned primarily to screen residents and visitors. And this was primarily for symptoms and travel outside of the northeastern Ontario. At that time, that's where we designated that outside of that area would cause for someone to self-isolate and receive a test. And to advise us of store closures. There was a lot of information out there, misinformation as well, saying our stores were open. So a lot of people tried to come in, and some of them wouldn't believe our checkpoint individuals, but you know, they did turn around and had to come in at a later time when we did open up. Due to easing of the pandemic and with the numbers dropping down, these checkpoints were taken away in the month of July. The restrictions further eased after July, and the stores were allowed to open with an opening plan, which consisted of standard operating procedures. And this included placing a screener at the front of the store, and wages were supported by the administration through the grant that was made available by ISC. So earlier in the slide, I believe in April, we noted that 61,000 came in from ISC, and that those were the funds that were used to support our retailers. Over the past year, we have learned and witnessed that border closures bring hardship to the community members, especially for our elderly population, due to access to services and family supports. The provincial government had placed restrictions only on travel from other provinces and countries. So keeping in line with these regulations, we encouraged our community members to avoid visitors from other regions. So that was the first question and the answer. I'm not too sure if we'll entertain questions now or just do it later. And I'll move on to the next question. What is the difference between a checkpoint and a border closure? So checkpoints are monitoring entries and exits, whereas a border closure had no entries or exits. So we felt that it was important to define this and let the community know what our definition of these checkpoints versus border closure was at that time. Our next question that we received was, what criteria does the emergency response team follow when making recommendations to council? So the gathering of all facts, statistics regarding the pandemic, the health department sits on many advisory tables at the same time, and in order to ensure that we have the most up-to-date information. So all of these information gathered and discussed at the emergency response team level, you know, really helped us to make those decisions to keeping the community safe. Performing an environmental scan of our local surroundings. So this included cases in Sudbury, in Atikokan itself, and in the communities across Ontario. So the emergency response team would review all these statistics. Our community health nurse would input the numbers, and we would review them. And at the team level, we met twice per week. At the beginning, it was three times per week, and then went down to twice per week. And Marina had inputted stats on a daily basis, so we can look at trends as well. Discuss dissecting the information, discussing ideas and options. So example, how to mitigate a situation, how to prevent a situation, and how best to continue service delivery while minimizing damage to local economy was, you know, the main goals of the emergency response team. We also evaluated risks, costs, and benefits at the same time. Considering the advice and protocols provided by the province of Ontario and the government of Canada also weighed heavily on our decision making. And again, you know, always trying to be 2 steps ahead of the government and really being proactive, and then looking to see what the impacts are from their decision making, and then allowing ours to go a little bit further than theirs. Considering the advice, weighing all options and ideas, agreeing on a plan of action. So example, further research, seeking quotes for the purchase of goods and services, relying on existing information to form thorough recommendations, and then drafting briefing notes to give on council. Did anybody from the emergency response team want to take the next question? Just to liven it up with a different voice.
Sure, I'll go.
Okay, Miigwech.
Okay, so the next question was, what supports are available from the COVID-19 Relief Fund? Funds are available for members or spouses and children where the member is the primary caregiver. The funds provides a basic amount for the member, spouse, and children, assistance with housing security, food security, which are gift cards that we issue to our off-reserve members. Meacham support is there for our on-reserve members, and also members who are in the Sudbury area. We do provide them with access for contactless pickup as well here at Atikokan. Funds for quarantine self-isolation, personal protective equipment, which are masks, cleaning supplies, hand sanitizer, gloves, wipes, and also for connectivity for members with children attending school online, and they were and that were not assisted by other Atikokan programs. If there are additional adults in the household, other adults must make their own application. The COVID-19 coordinator also assists members by referring them to other programs and services within and outside of our Atikokan government offices.
Okay, Miigwech, Pam. And Cheryl Conway oversees the COVID-19 relief response coordinator, and has provided, you know, different statistics to the community on how we've assisted our members, and you'll find those in the newsletter and I believe in the flyer at times as well. So if you ever have any questions, you can always call the coordinator or Cheryl as well. And I believe Paula too. The next question, what are the criteria to access COVID-19 relief fund? Anybody from the emergency response team want to provide the responses?
I'll just continue.
Okay, perfect.
So, so the question again is, what are the criteria to access the COVID relief fund? And these are limited funds, and it's important that the support is given to our members with the most need, who are being negatively impacted by the pandemic. In order to qualify for the assistance from this fund, you must be a registered member with the Tukamiksing Anishinaabe. That we do require, to confirm your band member number, be unemployed, underemployed, and experience hardship due to COVID-19 and or resulting from COVID-19. We're asking those applicants to specify other factors that we should consider. So when you do call in and talk with our COVID-19 coordinator, she does have an intake form, and that's we're asking all of our members to be very specific and listing the information, all information, so that we can make a really sound decision on the qualification. So we ask our members to cooperate and be truthful throughout the intake process, and we do consider household income as a criteria, because I want to make sure that there is a need, and it's not to be intrusive, but it's to make sure that we're attending those who are in the most need. Additionally, members are encouraged to provide us with their banking information so that we can make direct deposits to their accounts. We do mail checks to members, but it's not ideal due to posting delays. However, we do make those exceptions. And also we have had delivered food gift cards in small amounts of cash when there was no other resort. So lastly, at the beginning of every call, we ask members 3 consent questions over the telephone, which relate to personal information, consent, and communication. So we make sure that when we're going over the intake process with all of our applicants, that they understand what that means to give their consent to share that information.
Did you want to continue with the statistics? Just to keep it going for relief funding.
Oh, I'll let Cheryl chime in.
Okay, Miigwech. So this is a daily, this line, all squiggly, it shows the daily requests since the beginning of the pandemic until the first week of May. And so on average, well, not on average, you can see that at this third wave, we are averaging a lot more daily requests than at the beginning. At the beginning, it was few and not few and far between, but it was much less. There's the third wave, and the duration of the pandemic is causing a lot of hardship to our members, and so I think that's what accounts for the increased requests.
Okay, Miigwech, Cheryl, and the next slide goes over our COVID-19 relief funding to date. So I was wondering if you can continue with that piece.
Sure. So these are the number of community members and their dependents that received assistance. So again, you can see that the first wave all the way through to December, we were helping members, but it really spiked up in January until April and these few days in May. And again, I believe this is a consequence of the duration, the more stringent lockdowns, and more people being suffering from the consequences of this pandemic, including unemployment or underemployment, et cetera.
Mm-hmm. And then your last slide is
this is just the value in dollars and cents. The green is cash that we have, is actual money that we have spent, and blue is gift cards that we have sent. So again, you can see, not that much demand on the COVID relief fund in the beginning, but we really start to ramp up starting in November. And in we can see that in January we spent almost $20,000 in cash, and in April we're well over the 20,000, and so far the trend was to continue that.
Okay, miigwech, Cheryl.
My pleasure.
So the next question, I'm wondering if Gimal would like to take this one.
Sure. Thank you, Carmen. So one of the questions that I know I've been asked about is the emergency order. So I do receive calls from band members about that. And so Carmen and I met again with our police liaisons from the OPP and our constables last week, and we talked about this again. And basically our orders run parallel with what the provincial orders are. And so just like the Highway Traffic Act is enforceable on the reserve, so are the orders that are in place. They are enforceable on the reserve too. So the concerns that were brought forward about non-members or non-residents coming onto the reserve, and visiting others, or participating in events that they're not, or gatherings that they're not supposed to, that is an enforceable offense. So we've encouraged, I've always encouraged those band members to call to say you can report this because it is enforceable. And other orders that aren't, because we have, like Carmen was mentioning, we've always tried to be a few steps ahead of the provincial orders. So as you know, earlier this year, the province went into what they call a gray zone restriction, which was there were a lot more restrictions on travel and gatherings and whatnot. But we actually imposed our own, I guess, gray zone restriction back in November, and that was in relation to the retailers, and we created our own requirement to have the screener at the door. So as you notice, if you go into Sudbury, you don't see screeners anywhere, but because we wanted to protect the community and the retailers, the customers and the staff at the retailers, while reducing damage to the economy, we impose these standard operating procedures where a screener is required to make sure people are social distancing. To ask customers a set of questions, and we've always been updating those. We've always been in conversation with the retailers as well, and they've provided feedback on these procedures. So we do enforce them, and it's the responsibility of this team to monitor and evaluate who is following and who isn't, and then we make recommendations to council to if necessary, to enforce them. And like it says here, to make a report, you can contact the constables or the OPP.
Okay, miigwech, and they also accept anonymous phone calls as well.
Exactly, yeah. And so as a member, it's important to do our part, and this is one way to do that, to ensure the safety of yourself and others. And I know it's difficult, but it's important. The only way we can stop this or mitigate this is to report it.
Okay, now, so we're going to go on to the next slide, and the next slide, there we go. Why are stores allowed to remain open, and why aren't they curbside? So I'm going to ask Arvin if he can provide the response to this one.
Hi, everybody. Like it's stated here, the ERD, or Emergency Response Team, has deemed these stores essential. Like they do sell day-to-day needed commodity, and which are very much needed in the community, and therefore they are allowed to remain open. Previous closure caused more harm than good. There were traffic issues, safety issues. Therefore, so that the operator, as Gima stated before, that the standard operating procedure, which are a notch above than whatever is followed in the province, has been placed in here. And we can see that our measures have proven effective, and there has been zero transmission to the stores. Miigwech.
Miigwech. And I think, you know, the retailers need to be applauded and recognized for all that work that they've done. And looking at these standard operating procedures, and even, you know, implementing different procedures at their own, on their own as well, because I do recall some of them, they did end up going to curbside. Some of them, you know, just utilize their drive-through service at times. So I just wanted to make note of that. Our next question, will the vaccine be made mandatory to travel? So I will ask Marina to respond to this one. It is the short one, but Marina, if you can pleasure us with your answer.
So will the vaccine be made mandatory to travel? And as it says here, it's too early. We haven't heard yet. We will be following provincial guidelines. And so the future will, you know, we'll hear in the near future.
Oh, Gima? Oh, I think you're on mute.
I have another mute button there. Yeah,
Okay.
so it always happens. So I just wanted to make note too that at the band meeting on Monday, this was talked about, not in relation to travel, but in relation to, you know, revising our orders to allow or ease the restrictions on family gatherings, for instance, right? And so the I guess the impact of the vaccine now, like how do we go about and start planning around that, where an example being, you know, if two families that are on the reserve that are fully vaccinated want to have a gathering, when are they going to be allowed to do that? And those are the other types of questions that are related to the vaccine that we're now starting to field. And so I just wanted to say that because like Carmen mentioned, we've always been proactive, and we've always looked at the data that's the data that's is close to home, I guess you can say. And we also look at the trends, right? We know people are still gathering, right? It's we've asked people to maintain that, but we do know that it is happening. So we have to kind of enter into a different stage now, where it's not about just curbing the actions of it. It's about actually now more about risk management, and how do we go about reopening the community again, right, to where we were having these in-person meetings and gatherings. So I just wanted to say that too. But that first statement, it is too early to determine, is always the one that we've gone to, because really there's not a lot of solid data out there to support you know, a definite answer. So I just wanted to add that. Miigwech.
And I think another worthwhile additional is, you know, this USA or the States, they are looking at, you know, reducing their measures because of the vaccinations. So we'll get to see what happens, and then see those impacts, and then be able to Canada and Ontario, you know, will have those lessons learned from what they will experience or not experience. Our next slide asks, what are we doing to prevent the spread from members who are coming home? So this response is, when individuals are returning home from surrounding areas, They are required to adequately self-isolate and be tested. It is the responsibility of the individual or family affected to maintain that isolation. We have spaces available for individuals that may need to isolate outside of their home. And also remember that we all play a part in keeping our community safe. So that goes along with, education and awareness. There's a lot of educational material that we've sent out in the past. And then also utilizing public health's Sudbury and District's website for any material as well. Yuma?
Yeah, and I just want to be clear too about this because, if a person is coming back, they do not go to the home without getting tested and isolating first. So it's not you go to the home, get tested, and wait for the results of your test there. That's not what this is saying. It's saying that before you even go to any residence in the community that that has other people there, you're not allowed to do that, right? So I just wanted to make that clear too, because there shouldn't be any ambiguity in that. It should be really clear that you don't go see anybody, you don't visit while you're waiting for that result, right? It has to be made very clear.
Mm-hmm. Miigwech for that, Pamela.
And just to tag on to Gima's comments there, it's also like each time you're coming home. So if you're coming from those hotspots or areas with high numbers of cases, we recognize that we have some transient members or members who come and visit often. Each time they're coming from those areas, they are required to self-isolate and to be tested. So each time, it's not just once, and hope that carries you through. We expect everyone to self-isolate and to be tested when they're coming from those hotspot areas.
Okay, miigwech, very important.
Yeah,
addition.
and just one more thing too, and because we do know travel is essential to some of our members, right? So this is why that we had to. One of the other reasons why we had to look at this this part of the order, right? To make sure that we provided some support to those that had to travel, so for work purposes, for instance. So we wanted to make sure we supported them when they came back home to be with their family.
Okay, miigwech. So our next slide goes into what are our next steps. And here it's to continuously, to update the emergency response plan, update our reopening plan for administration and the community, improve communications and accessibility to staff and leadership, plan the transition from virtual to in-person activities, provide further information on essential services. So if you do access the reopening plan on the website, it is found in Appendix G. There is a definition, and communicating this with essential workers. Providing an updated reopening plan for retailers, partners, and tenants. Continuing to monitor and observe local, regional, and provincial statistics in order to stay ahead of all the trends. Continue with the COVID-19 Relief Fund and emphasize a risk management approach as opposed to solely a prevention approach. And continuing to apply for funding and support the government, support from the government relating to COVID-19, such as HVAC issues and updates. And I know Gary's been working really hard in the housing department to ensure that our homes are, have updated HVAC systems and other items. Any last minute, this is one of our second last slides. So any of the emergency response team want to elaborate on any of these? Gemma?
Yeah, and so we're going to keep meeting twice a week and have those special meetings when necessary, and also continue to make those recommendations to council. And again, as we said before, looking at how do we integrate back into the state of normalcy where we're interacting, safely. So I just wanted to highlight that part, is that's really, I think, on our minds now to focus on.
Miigwech. Pam?
And so I just want to just remind too that our emergency response team is handling 2 states of emergency. So so our meetings that we meet twice a week, they are rather robust. So it's not taken lightly. We do take our roles quite seriously. Just wanted to share with the community that now with the second state of emergency, we now are responsible for those responses. Miigwech.
Okay, miigwech. Gima?
Yeah, and just to build on Pam's comment, so we're meeting two times a week as the team, but we're also breaking up during the week into smaller teams to deal with certain things. So Marina and Carmen, for instance, they come to the team, and then they're providing their updates, but then they leave and they're doing their vaccination clinics, right? And Pam is working on spearheading the emergency response plan review updates. I'm working with Carmen and Pam on lobbying for funding, additional funding, and then the additional grants. So we're all, every team member basically takes I guess some marching orders from the team, and then they break off and like Carmen was mentioning, Gary, taking care of the infrastructure, and Arvin looking at all of the taking care of the retailers with those standing operating procedures. So the emergency response team is, spends quite a bit of time each week on making sure that we're constantly monitoring what's going on and evaluating and then making those recommendations to council.
Miigwech. Some good additional information. Okay, so at this time, we'll answer any questions, and feel free to comment in the chat or raise your Zoom hand for audio capabilities. This is the second last slide, and the other slide is closing remarks. So at this time, we will take some questions. I'm not too sure if I can show people and their faces. Can you see that on the screen? Or does it still show my slide?
You can see it. It's laid on top of your screen.
Yeah. Oh, okay.
Yeah, we can see it.
Okay. Okay. So does any of the participants have any questions?
There is a question in the chat.
Okay, let me open up the chat. Okay. There are exemptions to emergency orders at the provincial and federal levels under sections of the Indian Act and treaty rights. In regards to inherent rights to hunt, harvest, gather medicines, and participate in ceremony, etc., if we are following or taking into consideration the provincial and federal orders when creating and implementing our own, where do we stand with documenting and having our own exemptions? Okay. Any takers?
Yeah, I can start. As soon as I read that, I thought of the ceremonies, the drumming that we had, all of the programming that we had, regarding our traditional ways, and we definitely agree that that we have those inherent rights, And as a team, we talked about that, making sure that we could offer as much of those ceremonies without compromising the safety of our members and the staff that are responsible for those programs or ceremonies, and even those individuals, you know, that aren't staff, just members of the community that conduct the ceremonies. And so that's always been, you know, the underlying factor is the safety of our members. And because once we, especially when the variants of concern hit and the data supported or showed that, you know, it was more transmissible, the symptoms of those variants were a lot more aggressive and had a more of an impact on those that became affected. We said that, you know, we could carry on those ceremonies that could be done, you know, at a safe distance while following the protocols, right? And I think that was you know, a decision made by consensus amongst the team. We always wanted to keep the ceremonies alive and as much as we could, but you know, we absolutely wanted to keep our members safe by basically following the provincial orders. We all agreed, I think, that those were the safest measures in place to keep everyone safe. And I think we you know, at some point though too, there was interpretation made on some of the restrictions. Like we thought about funerals, for instance. We did modify our orders a little bit, you know, to allow more family to attend those funerals. And so when we did things like that, we had to ramp up our protocols and measures and supports. So that included, you know, training community members to be screeners, and so these screeners would be utilized at times during like funerals and the vaccination clinics or whatnot, so that, you know, we could ensure there's enough people to help maintain that physical distancing for those participants. So yeah, it was very difficult because of the ever-changing landscape with these restrictions, and you know, and just the like the imposition, we've been imposed upon our whole existence really by a government, and sometimes the trust issues were there. And then, you know, I too like didn't really understand the orders sometimes, why they would do certain things or suggest certain things, and so that's really, you know, why we did things in a team environment, because everybody was provided different perspectives into these decision making and recommendations to council. And you know, that's why we're saying right now, you know, we're coming close to summer, we're coming close to our annual gathering again. You know, I went on a fast and I had help during the ceremonies, and that, you know, and having to maintain those rules as well. So it's I think the need to have the ceremonies is just as strong as the need to protect each other. So I think that's why we always try to come up with solutions that would allow that. So yeah, does anybody else want to add to that? Did I miss anything?
Yes, and I think, you know, in the beginning when we did have our borders closed, that was a really difficult time for the community, because, you know, not allowing individuals to come into the community so they can hunt, so they can fish, to, you know, do any ceremonies at the sacred grounds. It was really difficult and really hard. So that was a little bit, you know, a little bit more uneasy, especially for, you know, the team to respond to all of these different questions. So with that, you know, we did, you know, extend that provision, and then, you know, allowing our members to come in and do that. And then today, you know, we do have in the mental health and addiction, we are permitted, it is an essential service. And that's part of, you know, keeping ourselves healthy and safe, is to allow for that hunting, allow for that, you know, harvesting of the food, allowing for ceremonies. And, you know, it's really important, and it does help the family, helps the community. And again, what, you know, Gamal was mentioning about the gathering, you know, that's something I'm hoping that, you know, we could do this year, especially, you know, hoping that the numbers do go down, and the government now is looking at a different framework. So we won't be going to those color-coded systems again. But awaiting, you know, those decision-making at that level, and then really looking at how we're going to incorporate different measures in our community based on that. So a lot to look forward to, but a lot of, you know, lessons learned over the past year as well. And having that understanding that, you know, our inherent rights, all of, you know, the things we do to help keep our families safe and healthy, is really, really important and key for decision making. Okay.
And Carmen, I see that one of our participants has raised their hand, so I will give them the audio function to speak.
Okay, perfect. Miigwech, Isaac.
Here you go, Liz.
Hello.
Hey, Liz.
Okay, hi. Clearly that was me that posted that. So thank you for your responses. I'm more curious about going with what Carmen said about under the mental health and all of that. And I'm more curious about actually documenting that we have that exemption under the mental health, because when we speak of safety and wanting to make sure people are safe, myself and others are often the target of, why are we still doing these things? Well, if something in the order that does state that there are exemptions under the Mental Health Act, that might help us feel safer.
Yeah, that's a good point, Liz. We definitely can, like, it is in the orders that we state that. I guess it's more, like I said, just, you know, about our endorsing the provincial order. But I think in our next communication, we can put something that we as much as we need to prevent and mitigate COVID, we also need to take these measures to continue to maintain and build up the mental health of individuals, and this is what we're doing, kind of thing. So I think for our next communication piece, then we can definitely include that and acknowledge, you know, those staff and members who are doing that, right? So because we do know it's community members that are doing this, you know, to help others. So Carmen, I think we should make that a highlight of our next communique. So miigwech, Liz.
Thank you.
Definitely, will do. Any other questions? Okay. Okay, so is there any last statements or anything that the emergency response team wants to share or highlight? Okay, Gima.
Yeah, there was a couple of things during the presentation too that the relief funds that you saw on the slide were a mixture of grants that we had applied for, and also a mixture of own source revenue that council felt important. We needed to, there were some gaps there, particularly in the COVID relief area for the housing and those types of supports. And so I just wanted to make sure that, you know, it was known that council really supports the efforts of the team and they felt it necessary this year by allocating another chunk of money from the own source revenue. I don't know exactly, I should know that, but this year, so that funding is continuing because the grants, some of the grants are used up now, and so we're still applying for more dollars though. And those when you saw the numbers in the graph too, there are members who were applying more than one time as well, right? So we didn't just say, okay, this is a one-time thing. You know, we're only going to help you once here. No, we provided that support, you know, to those who needed it when they needed, and it didn't matter how many times they accessed, as long as they demonstrated the need. So I wanted to say that too, and also too that, you know, during this the whole COVID-19, our efforts to communicate what we were doing was a priority for the team, and this is why we're having this session now too. But also to help our members understand too, sometimes the level of communication that they may be expecting in you know, in the flyers or on the website, privacy is one of our big concerns as well. So when there were cases in the community, we had to respect the privacy of the band members. That is, you know, the number one rule, I guess, when dealing with health issues. Like, we have to do everything to respect them and also to support them. So we debate on this all the time about how much information we send out to the community, and how do we do that in a way that doesn't impact the privacy of those individuals that are involved. So that's always a standing item pretty much at our team meetings. But I just wanted to stress that with the attendees that you know, we always take privacy very seriously and do our very best to make sure it's upheld. Miigwech.
Okay, Miigwech. You're going to hear my granddaughter in the background. She's got the drums out. So are there any other questions from the panel, or any last statements from the emergency response team? Okay, so that leads us to our last, the closing remarks. And sorry about that. She's having fun. The presentation will be available for viewing on the members portal. And looking at seeing if all of the emergency response team can put on their videos showing their face to the panelists, and this way we can see everybody. They can see everybody.
Oh, and there was a post in the chat. Go Habs, go. Thank you, Liz. I'm cheering for them as well.
Okay, there's John, Emily, Isaac. Okay, so I just wanted to, you know, make sure, you know, you can see everybody on the emergency response team, because we all know we're all working virtually, and it's really nice to actually see faces, and really looking forward to the time when we can go face to face. Looking for, you know, the what's going to happen in the next few months, as now that we're going to be vaccinating our younger population as well. So a lot of things to look forward to, a lot of, you know, unanswered, I guess, questions that we're waiting for as well. And as soon as we hear information and make decisions at this table, we'll always inform the community. And Yeah, so really looking forward to some changes in the future, and this is your emergency response team. So I want to thank you all for attending, and I look forward to having more sessions like this. Maybe what we can do is provide quarterly sessions, because we do provide updates in the weekly flyer along with the newsletter, and then you'll see different updates from the different departments as well. So always keeping that in mind, and members portal, spread the word, ask everybody to, access their members portal for any documents that they require. On the website, you will see a COVID-19 section there, and Isaac maintains the website along with Emily. And having those supports available, I think, is really key to communication as well. So yeah, that's my closing, and I want to thank everybody for coming, and look forward to doing this again, possibly having more members attend, and yeah, miigwech and pamapi.
Miigwech, everyone. Palma P.
Bye. Bye.
Miigwech.